In this podcast, we're going to go over the medical applications for radioisotopes and the nuclear chemistry that we've learned. So we've talked a lot about the dangers of exposure to radiation. We've talked about emission of particles. We've talked about going from a more stable to less stable nucleus and vice versa. Now we're going to just back it up for a second and think about the medical applications of those radioisotopes. So we've said a lot of stay away from them, protect yourself from them, but they can be very useful in both diagnosing and treating patients. When we use radioisotopes in diagnosis, we have to make sure that the radioisotopes we're using have short half-lives, but yet they have to be long enough to be administered. So there's that sweet spot. We don't want them sticking around for 5,730 years, carbon-14. They have to be able to be administered in low doses. The last thing we want to do is kill our patient by giving them too big of a dose of a radioisotope. We don't want to cause more harm than good. We also want to make sure that whatever these radioisotopes are decaying into as the nucleus becomes more stable, that decay product needs to be stable and it needs to be non-harmful to the body. Also, we want to make sure that those will be quickly eliminated from the body. Again, we don't want these things hanging out in the body because we know what long-term exposure to radiation does. When we are giving radioisotopes to use in diagnosis, what doctors are looking for is to find out if an organ is functioning properly, or we're looking to detect the presence of a tumor. To get that radioisotope into your patients, it will either be injected through an IV or ingested by mouth, and the radiation that's emitted is then used to create an image or a scan. And so one example that you're seeing here is the HESI scan, which stands for, bear with me, hepatobiliary immunodiacetic acid scan, hence why it's the HESI scan. I wonder if they say HIDA. I don't know. Somebody get back to me on that. But it uses one of our favorite isotopes that we've talked about before, and that's technetium-99m. And it's used to evaluate the functioning of the gallbladder as well as the bile ducts. So if the image that comes back has bright spots, bright areas, then we know that there is normal functioning of the gallbladder as well as bile ducts. If there is dark spots or we're not seeing those bright areas lit up, we know that there's an obstruction, possibly, or inflammation, and the obstruction may be caused by gallstones because they're not uptaking the radioisotope and the isotope's not moving freely through there. I'm sure you're probably asking yourself, boy, it'd be really neat if I could see an image of what you're describing. Sit tight. All right, so now we're looking at those images from that HESI scan, and the images on the right over here are the scan, and then if you're like me, you don't know much about anatomy, you're going to need that visualization of the liver and the stomach and the gallbladder. So the gallbladder is what we're looking at and we're looking for here. The areas that are really bright, so we can see this really bright area here, is going to show normal function for your liver, your gallbladder, and bile ducts, or at least that's what we're looking for. So notice that the liver is lit up. I'll just use this image. That's kind of a little bit more opaque. That's lit up. It's homogeneous distribution that indicates normal liver function. With normal excretion into the bowel. What we are not seeing is the gallbladder here. So we're not seeing our gallbladder lit up correctly, and as a result, we're able to diagnose this patient with having an inflammation of the gallbladder. So something there is not functioning correctly. It would be considered an abnormal scan. And here's just another example of using a radioisotope or a tracer isotope. Both of these images, A and B, are using technetium-99m. The one on the left, A, is a bone scan using that, and the image on the right is a PET scan. And this patient has metastatic prostate cancer as well as osteoblastic skeletal disease. So we're expecting our tracer to collect where there's tumors. So we expect that to be these darker marks. So yes, prostate cancer. So the bone scan, which is the bone scan is A. That's showing a greater number of metastases and a greater lesion to background ratio than what's seen on the PET scan. So both of these could be used in very different ways, but both confirm the same diagnosis. One other thing I want to draw your attention to is kind of some background noise on there, and you can see those are roughly in the kidney area. We also see that that's lit up by the tracer. That doesn't necessarily mean that there's cancer in the collecting duct. That just means that the body's doing a great job of collecting that radioisotope in that tracer and processing it for elimination. We also see it being collected in the bladder for elimination as well. And we briefly touched on this in our previous podcast, but I'm just going to mention this again when we talk about radioisotopes that are used in treatment. We want to kill disease cells. We want to kill cancerous tissues with these radioisotopes. Keep in mind that the radioisotopes and the materials that are emitting radiation are non-selective, so they're going to kill cancerous cells and they're going to kill healthy cells, but they kill cancerous cells at a faster rate than they kill healthy cells. So that's why we go ahead and still put those into the body. If we are trying to kill cells, we are going to need higher dosages for those, and we can use external radiation therapy, which uses a radioisotope beam. So you're seeing that machine there. We had talked earlier about cobalt-60 as being an example of a radioisotope that could be focused on a tumor to kill those cancerous cells. Brachytherapy we've also mentioned, but we haven't used that term yet, but that's when you implant a radioactive isotope at the site of the tumor. So we talked about using gold or titanium pellets that have a radioisotope in them and placing those near the site of cancer. So we previously talked about how PET scan machines work, and they use positron emission. Let's go back into that once more, but let's talk about the medical applications. We'll move a little bit further with our knowledge. So PET scans are using radioisotopes that emit positrons. So if you remember back from a couple podcasts ago, the positron gets emitted and it will collide with an electron. So that's the opposite particle. A positron and electron will collide. When this happens, annihilation occurs and a photon of energy is released. And it's that photon that allows us to get the image of the scan. So for a PET scan, we are using radioisotopes such as carbon-11, oxygen-15, nitrogen-13, and fluorine-18. So specifically, carbon-11 and fluorine-18 can be incorporated into glucose. And this is kind of brilliant because we can then give the patient the glucose, and any part of the body that usually uses a lot of glucose is going to light up on the image or the scan. And so your brain uses a ton of glucose. That thing is burning glucose like crazy. So in a normal functioning brain, we expect it to completely light up. That tracer is being collected, it's using glucose. With mild cognitive impairment, you can see that there's more of those darker spots, so there's not as much glucose being used, and therefore it's not coming up as bright on the PET scan. And Alzheimer's disease, we see a larger portion of the brain that is not using a ton of glucose. It's showing a decrease in activity. In this image below, if you're not familiar with Alzheimer's disease, it's characterized by insoluble deposits in the brain called amyloid plaques. And in this particular image down here, those amyloid plaques are going to show up red on the PET scan. So see, this normal functioning brain has very little of that red, so it has very little of the amyloid plaques, versus the abnormal. So this person or these people potentially have Alzheimer's. They have more of those amyloid plaques because they have that brighter red, and that's a little different test than what we're looking at up here. Other than Alzheimer's, we can also use PET scans to detect tumors elsewhere. Those are cells that use a ton of glucose, so they're going to light up. Coronary artery disease, strokes, we can also use it to detect cancer, obviously, because tumors, cancer. I don't know about you, but I could look at these images all day long. I think they're super interesting. Hopefully at this point in our podcast, you know that there is something drastically wrong with our scan on side A. This is another example of a PET scan, a positron emission tomography. This patient has metastatic melanoma. So this was before treatment, and I am so thankful to say B is the same patient after treatment. So they went through a particular type of treatment that really cleared up their metastatic melanoma. And so that is at least one bright spot that's not tumors. That was a bad way to say that. I have a feeling this is going to be a test question. So we have a ton of different types of scans that can be used in both diagnosis and treatment, but not all of them are going to use radioisotopes. So we're all familiar with X-rays. X-rays are using electromagnetic radiation. This shows differences in tissue density. It's a really good diagnosis test to use for something that is very dense, like bones. Obviously, that's not going to work if you twist your knee or your ankle. That's a soft tissue issue. CT scans. I crack myself up. CT scans are computed tomography, and these are actually using X-ray beams that produce high-resolution 3D imaging of the body. Also, because we're looking at X-ray images, this is not great for soft tissue, but it's a little bit better. Also doesn't use radioisotopes. And finally, MRIs or magnetic resonance imaging. They're using low energy radio waves to measure magnetic changes. These are really good for soft tissue. So if you have a soft tissue issue, I wish I could come up with a better way to stop rhyming that, but here we are. That would be the more appropriate scan. And PET scans are the only out of these that would require radioisotope or nuclear chemistry. All right, this last image just kind of shows the differences between MRI scans, CT scans, and PET scans in terms of what your doctor is going to see or your radiologist is going to see. So your MRIs are being used for soft tissue, tendon, ligament, and brain diagnosis versus X-rays are more for your skeleton, sometimes blood vessels, and then that PET scan can be used for cancer, heart, brain, a lot of different things like that. And then the time frames, like I had no idea how fast a CT scan is compared to a PET scan. Anyway, found that really interesting, thought you'd like looking at it.